I work at Mercy One in Sioux City, and I work on the neuro-ortho trauma unit.
I work at Unity Point Health in Sioux City.
I'm a registered nurse at Siouxland Community Health Center.
And I work at CNOS.
And I currently work at CNOS Dermatology.
Anybody who has had a car accident, a motorcycle, any sort of accident or injury, usually they come to our floor.
I was a volunteer in Kenya for a missionary from the United States of America, and I was there for about 4 years before I came here and helped and became a nurse through Western Iowa Tech.
When I began as a nurse, we did everything on paper. We had no computers in the hospital on the floors or the units.
Actually, when I started out in internal medicine. We had some internists there at CNOS, and then I moved on after the physicians retired. Then I moved on to endocrinology. That position, left the practice, and then I moved on to dermatology, which then became my third love in nursing.
There are days where we take a patient who maybe has all but one limb that's broken, and we figure out how to help them walk. That's pretty rewarding.
Definitely COVID was hard. It was hard when life shut down and there was uncertainty, and yet we had to go to work. It was definitely a big learning curve as well. But I've learned that I can do it and that we can do it in healthcare, and just very, very happy that it's over.
I have been fortunate to work with wonderful physicians who are very easygoing, work well with patients. But a lot of times the physician will leave the exam room and the patient will turn to you and be, what did they say? What does that mean? A lot of education to be done maybe on their treatment, tests that they're going to have done, what their medications are.
The most rewarding is meeting people out in the street. Sioux City is a pretty small city, and having people say, "Hi, Liz, do you remember me?" And I don't.
Nursing is just something that I have always wanted to be. Back in high school, I had the opportunity to get a job at one of the hospitals as a nurse aide. Loved it, and then just decided, I like this. I like what I'm seeing with the patients, how much they rely on the nurses and the physicians, that I want to be a nurse.
I've always wanted to be a nurse. My aunt, who is with me here tonight, has been a nurse for 42 years, and she's my namesake. I was named after her, and I've always been inspired by her. I hope that one day I have all of the knowledge that she has, and she continues to be my biggest inspiration.
When I was 12 years old, my grandma was passing away in hospice, and I saw how compassionate those nurses were, and I knew that that was my calling.
I had a grandmother who lived quite a ways away from us, but she would come and stay with us when she had various surgeries or needed some extended care of some sort, and she would move in for us during that period of time and live with us. I enjoyed helping her, giving her care, and I really enjoyed the special one-on-one time that it gave me with my grandmother. I got to know her.
The part I enjoy most about my job is the relationships that I've cultivated with my patients. I enjoy seeing them throughout the year, catching up with them, asking them how they're doing, how their family's doing, how their pets are doing, and that's really where my joy comes from, is the relationships that I have worked to build with my patients.
Knowing that, there's so many different avenues in nursing, but knowing that you're always going to be that advocate for the patient, and you want what's best for the patient and their outcomes.
Progress is slow, but very rewarding to help with that process.
Being a nurse is not just a career, it's not just earning a living, it's actually living life and being able to understand and walk in the shoes of other people.